Lateral facial dysplasia. First and second branchial arch syndrome. Oral-mandibular-auricular syndrome. Atomandibular dysostosis. Craniofacial microsomia. Type I, mild hypoplasia of the ramus, and the body of the mandible is slightly affected. Type II, the condyle and ramus are small, the head of the condyle is flattened, the glenoid fossa is absent, the condyle is hinged on a flat, often convex, infratemporal surface, the coronoid may be absent. Type III, the ramus is reduced to a thin lamina of bone or is completely absent. There is no evidence of a TMJ. Hemifacial microsomia, HFM, is a congenital disorder that affects the development of the lower half of the face, most commonly the ears, the mouth and the mandible. It usually occurs on one side of the face, but both sides are sometimes affected. If severe, it may result in difficulties in breathing due to obstruction of the trachea, sometimes even requiring a tracheotomy. With an incidence in the range of 1 to 3,500 to 1 to 4,500, it is the second most common birth defect of the face, after cleft lip and cleft palate. Goldenhar syndrome, also known as oculo-auriculovertebral (OAV) syndrome, is a rare congenital defect characterized by incomplete development of the ear, nose, soft palate, lip, and mandible. It is associated with anomalous development of the first branchial arch and second branchial arch. Common clinical manifestations include limbal dermoids, pericular skin tags, and strabismus. The term is sometimes used interchangeably with hemifacial microsomia, although this definition is usually reserved for cases without internal organ and vertebrae disruption. It affects between 1/3, 500 and 126,000 live births, with a male-female ratio of 3 to 2. Treacher Collins syndrome, TCS, is a genetic disorder characterized by deformities of the ears, eyes, cheekbones, and chin. 5. The degree to which a person is affected, however, may vary from mild to severe. 5. Complications may include breathing problems, problems seeing, cleft palate, and hearing loss. Those affected generally have a normal intelligence. TCS is usually autosomal dominant. More than half the time it occurs as a result of a new mutation rather than being inherited from a person's parents. The involved gene may include TCOF1, POLR1C, or POLR1D. Diagnosis is generally suspected based on symptoms and X-rays, and potentially confirmation by genetic testing. Treacher Collins syndrome is not curable. Symptoms may be managed with reconstructive surgery, hearing aids, speech therapy, and other assistive devices. Life expectancy is generally normal. TCS occurs in about 1 in 50,000 people. The syndrome is named after Edward Treacher Collins, an English surgeon and ophthalmologist, who described its essential traits in 1900.